2 minutes started.
Okay, ma'am.
3 pages total.
Okay, okay, ma'am. Next page, ma'am. Okay, next, ma'am.
Hmm? Starting your 10 minutes time.
Hello, I'm Dr. Sneka, one of the doctors in the postnatal clinic today. Can I confirm your name and age?
Yeah, I'm Clingy and I'm 21-year-old doctor.
All right, how may I address you?
Clingy is fine.
All right. Clinging, I'm aware of your notes, and Clinging, first of all, I'm sorry for the loss that you have had, and please accept my condolence, Clinging.
Oh, doctor, it was very painful. I was
I
really
understand.
devastated. Thank you.
I understand. It must be a difficult situation for you, Clinging, but do not worry. We are here to support, help, and support you. Clinging, I'm gone through your notes, and I understand that you're here to discuss about the results that you have. I mean, the blood test and the postpartum examination reports. Am I right?
Yeah, yeah.
Do you have any other concerns and expectation out of today's consultation?
Just I wanted to know why I lose my baby.
Sure, I'll be addressing it quickly. And is it okay if I ask a few questions to know more about you so that we can make a shared care plan? And
Okay,
also, I'll give you the written information on all what we discussed. And I'll also fix an appointment with my consultant. Will that be fine?
okay.
All right. Clingy, can you tell me how are you doing now?
Yeah, doctor, the recovery was very difficult. I took time to recover. I'm fine, but my partner is still not come out of this grief.
I understand that. Have you been, both of you have been put in touch with any bereavement counselors or
Oh
support
yeah,
groups?
yeah. We are in touch with support group and counselor.
All right, we can also help you with both of you and your family members as well to come out of this clinic. May I know, currently, do you have any pain in your tummy,
No,
bleeding?
no.
All right, and how is your bowel and water works?
Yeah, fine.
Okay, any breast pain you have?
No.
All right. And Clingy, I need to ask you questions related to your pregnancy and delivery. I'm sorry that I'm bringing back your memories, but still, we need to ask this. Can you tell me in detail what exactly happened that day?
Yeah, doctor, actually, this is my first pregnancy. Although it was unplanned, but then everything was normal, smooth, and me and my partner, Luke, has decided to go ahead. Everything was normal. We had labeled our baby's name as Jack, and things were going pretty normal up to 37 weeks. I don't know why suddenly I started having pain. Initially, I thought I'm having a labor pain, but then it was very severe. I got admitted to the emergency, and
Mm-hmm.
when we tried to look at the baby's heartbeat, they said no, they couldn't able to detect the baby's heartbeat. They offered me a scan, and by that time I had lost Jack. And then there was sudden gush of bleeding. I had aborted the baby within next 2 3 hours. They said something like abruption, and yeah, I delivered within 4 5 hours. I was
Mm-hmm.
admitted into a intensive care unit where they had transfused me. I was there for 3 days, and after that they discharged me home.
Mm-hmm.
I required 2 to 3 pints of blood also.
I'm sorry about that, Klingy. Can I access your notes with your permission? Would that be fine?
Yeah.
All right. And how's the Jack scan reports throughout your pregnancy? Was Jack gaining weight
Everything
normally?
was normal. Everything was
Okay.
normal.
All right. And a few questions like, did you have any trauma to your tummy during your pregnancy?
No,
Any rise in blood pressure specifically?
no, straightforward
Okay.
pregnancy.
All right. And are you both related by blood, you and your partner?
No,
Okay. And any other medical concerns did you have, like
no,
diabetes, hypertension, thyroid? Okay.
no,
Any surgeries in the past?
no,
Okay. Any family history of concern, like any genetic problem running in the family or clots history in the family?
no,
Okay. Any personal history of clots?
no.
All right. And do you have any allergies?
Yeah, I'm allergic to aspirin.
Mhm. I'll make a note of it cleanly. And you had a personal question like, do you smoke, take alcohol?
Yeah, doctor, actually, before the pregnancy, I used to smoke, I used to have drinking. But once I got pregnant, I had reduced it drastically. And now, again, after the traumatic event, I have restarted it.
All right. And about the alcohol?
Yeah, I'm too taking it just to minimize my grief.
I understand, Kenny, but I need to tell you that generally smoking and alcohol intake it affects women's health as well as it alters the pregnancy outcomes as well and also the baby's outcome. So it will be good that if you completely quit smoking, but
Yeah.
if you wish, I can connect you with the stop smoking services and the alcohol services. Will that be fine?
Yeah.
All right. They can also offer you some other replacement therapies also like nicotine patches, etc. Okay.
Yes, doctor.
All right. And may I know how is the support around you?
Support, yeah, actually, Luke is taking so much of time. I do feel devastated looking at him. That's the only worry what I'm having.
Do not worry. We can also involve the mental health specialist as well to have a consultation with you. That'd be fine,
Yeah,
both of you.
yeah.
All right. And a few other questions like I must tell you that it will be kept confidential, whatever I ask. Did you have any form of abuse? Because some women in situations like this might have had.
No, no.
Okay, okay, fine. May I know your blood group?
I think it's A positive,
Okay, and your weight to height ratio?
normal.
All right. Do you like to add anything else?
No, doctor.
All right. Thank you for sharing the information cleanly. And let me discuss with you about your results. And I've confirmed that it belongs to you with the name and NHS number. Do you like to have someone with you? Because we need
No,
to share a lot
doctor.
of information.
It's okay.
All right. So, coming to your reports, first of all, the postmortem examination of the baby says that it's a male baby, and yeah, the baby has been completely normal, and the baby doesn't have any developmental problems, and some weighs around some 1.9 kgs. All right. And also the certain blood test that has been done also seems to be normal. The concerning thing is that the afterbirth which was examined shows that there have been several clots, and also there have been a signs of early separation as well, what we call it as abruption. Are you
Oh
with me
yeah,
so
they
far?
mentioned that. Yeah, they mentioned that. I wanted to know what it
Mhm.
is.
Yeah, let me explain to you. And there is another concern that the blood test, the special blood test called protein test that has been done, also turned out to be positive. And in that case, we suspect that you have a condition called antiphospholipid antibody syndrome. Have you heard about this before?
No, never.
I would like to explain in detail. This is a condition like where our body's our body immune system produces certain proteins that affect our own body tissues, and also it increases the risk of clot formation in the legs, lungs, and also sometimes in the afterbirth, such that it will cut off the blood supply to the baby, and which can stop the baby's heartbeat.
Oh my
And
God.
also, it can cause early separation of afterbirth, because of which you might have had the pain and the bleeding what you have experienced. Are you
Oh
following me till
God.
now?
So it was totally my fault, doctor.
Klingi, please do not feel that way. It's nothing that you would have done to prevent this, because in 50% of cases there is no reason found at all. But there are it is treatable, and we can take you through that. Will that be fine?
Yeah.
All right. Coming to your management plan. I will put you in touch with the multidisciplinary team involving my consultant, and as we have to involve a blood doctor as well, and the we'll also involve a clinical psychologist. Your even your partner, the GP, will be involved in your care. And since this is a blood test that has to be repeated between 12 weeks time interval, so we will repeat your blood test after 6 weeks to confirm that exactly the diagnosis, right?
Giving you extra 2 minutes.
Sorry. Yeah.
Hmm.
Hello. Yeah, so we need to repeat the blood test after 6 weeks to confirm the diagnosis. And also, we will start you on folic acid, and we
Hmm.
would encourage you to follow some lifestyle measures, Clingy, like you can follow a healthy diet, and you can have a healthy weight, maintain a healthy weight, and follow some yoga exercises. Okay, are you with me?
Yeah.
All right. And when you have your next pregnancy, we would like you to come for early booking at the specialized clinic called Rainbow Clinic. And it will be under consultant led unit care, where multidisciplinary team will be taking care of you. Are you following me to now?
Yeah.
And Klingi, I must tell you that this condition have some implications on baby and mother as well. Like it can cause rise in blood pressure, and can cause increased of clot to the mother, and early separation of afterbirth, and risk of having premature baby. Baby can be smaller as well, and sometimes the possibility of baby dying in the womb as well. So, for which we would
Is
monitor
there
you
any
closely.
chance of yeah? Is there any chances of having it repeatedly?
Kingi, there is a 1 in 20 chance that it can recur, but as I told, it is treatable and preventive measures are there. So I'll like to explain that further. Is that okay?
Okay.
Yeah. So for this, if it is case is confirmed, then we will start you on special medication called low molecular weight heparin, which would decrease the risk by 50 to 70%, and it will help you in getting a healthy pregnancy outcome, for which we'll be involving our hematologist as well. The blood doctor will be involved in this, and we'll start you once your pregnancy test comes positive. All right, and you will continue with that till 6 weeks after delivery as well. And generally, for this condition, we would consider starting aspirin also, but in your case, since your allergy, we would omit that. All right, but we'll take
Okay.
an input from the blood doctor as well. Will that be fine?
Okay. Can I start trying for
And
the baby, doctor?
yeah, since you and your partner, once you have recovered out of the situation, and once you're emotionally and mentally, physically fit to go for, then you can try for it.
Yeah. So also, I'd want to ask you. I'm having this difficulty in uh, establishing sexual intercourse. I thought something is really very hard and very bad below. on my private part because I started bleeding heavily. So I'm afraid, doctor.
All right. It is very normal to feel this way when you're emotionally disturbed recently. But we can take a look at there. We can do an examination as well, and also we can involve the psychosexual counselor as well to address this. Will that be fine?
Okay, thank you.
Yeah. Anything else would you like to know?
No, thank you.
All right. So, and Cynthia, I would like to tell that you will be monitored closely in your next pregnancy, and also your baby's growth also will be monitored, and you will plan your delivery as a routine when you reach near term. And after delivery, you will be cared one to one, and you will be given contraceptive advices, avoiding any estrogen containing pills as well, and will encourage you to continue the heparin injection what you're on till 6 weeks, and yeah, this will be done for you in the next pregnancy. Okay, so right now I'll put you in touch with the hematologist who can offer you a further blood test, the same antibody test after 6 weeks, and we'll start you on folic acid, and we recommend you to follow the lifestyle measures in the, and I'll document our discussion. All right, and you can be in touch with the counselors and support groups. Thank you for your time.
Okay, thank you, doctor. Okay, your own feedback?
Maybe I exceeded the time.
Yeah. You have to complete the same thing within that 10 minutes. Hmm?
Yes, ma'am.
So now
I
you
took a
know how
long
to
time,
go
ma'am.
ahead. Yeah, almost 15 minutes.
15 minutes. Okay. I thought I should cover this uh, both all antenatal, interpartum, and postpartum.
Yeah, you have to cover it definitely, but then you have to take it, you have to quickly enter into the task, okay? You have to ensure that your first part, that introduction part will be within that 1 minute's time, and then complete your history taking by 4 minutes, that is by the end of 5 minutes, and then rest of, at least you will have that 5 minutes to explain what exactly her plan will be and address her concerns, okay?
Okay, ma'am.
So,
So history got
yeah,
prolonged.
history was 7 minutes, completed at the end of 7 minutes.
Okay, ma'am.
And she's also having so
I'll take
many
care.
things to say, yeah, so many things to say. So ensure that listen, and then you can avoid skip few questions, okay, if possible.
Okay, ma'am.
I will not say that the totally irrelevant history, the history was still relevant. You missed out on sexual history here, which was a very significant history. Have you resumed sexual intercourse? Are you using any form of contraception? Is very important history. Not to use COC, avoid COC till we have your blood test, okay. So those history
Yes, ma'am.
points were missed out here, dear. Then the management was perfect because we all know that this is a almost similar to the RCOG exam task. Okay, so the management was very good. Checking her knowledge about the report is very important. Do you have any idea about the report? Did someone discuss with you?
Okay, this guy. Okay.
And then explain her what is normal, and then go to the abnormal one. So your proteinase is less, your biochemical investigation test are whatever that mentioned normal, you explain everything, okay? Do not say only one or two investigation.
Okay.
Normal first followed
Everything.
by abnormal, yeah, always. That unless and until you will not inform explain that it, you will not mark. I will come to each one of you, so don't worry, just raise your hand. I'm happy to help all of you. Rania, the only one thing which you need to remember is who is this? Whatever you know little, put it under headings, and that would help you to pass this exam. Put it under headings. Don't be like a scared chicken where you don't want to open your mouth. This is as simple and as straight. Don't stick to few recalls and say that no, ready. Don't have. Okay, so sorry for interruption. So this is actually the way you have to see where I think you were again and again saying same things, so you can minimize those things. What that is what I felt, okay. Can minimize
Okay.
those things, those, okay, I'm going to help you out, we are going to help you out. So if you are in the beginning, when you said, I told you regarding my loss and it is difficult, so rather than telling her that we are there to help, I understand your feeling, and the we are going to help you and support you, I would not have said that, oh, I know it's difficult, are you in touch with, how are you coping, are you in touch with the SAN support group and bereavement counselor, how is your partner?
Okay.
So the same thing can be dealt with the different sentences, but your history will be completed by that time. Yeah, you acknowledge, oh, it must be very difficult. Are you in touch with a bereavement counselor? Are you and your partner Luke is in support in touch with the bereavement counselor? How both of you are coping? Okay, so you got my point. The same
Yeah,
sentences, the long
you
sentences
can
what
cut
you are
short.
using, yeah, you can cut it short, and you can here you can use the sympathetic language what you need to ask. Okay, so that way you can minimize at least 1 or 2 seconds, but you need to practice cut short your sentences so that your history taking will be in time. Almost everything you covered, only thing it is time management, and unless and until it will not be within time, you will not pass this task. Okay, we had just discussed about consultant-led care booking and aspirin and low molecular. By that time, mostly you only few things we had discussed. Okay, in that 10 minutes time, so that you may not be able to pass this task if we will go this way. Okay, so answer key is almost similar when it go. So I will always introduce whenever we are seeing a patients who are having any traumatic events. So I will address them by name and ask how is she, offer her condolences. You know that you are in seeing her in a postnatal clinic. Uh, Ask how is she. Do you want someone during the consultation? Whether she and her partner has been coping, how they are coping, and are they in touch with the SANT and bereavement counselor, and did they name the Jack baby? Okay, so Jack, somewhere somehow it will come, definitely comes. Then the few questions what you said, any bleeding, pain, vaginal discharge, review your case notes. Okay, and then history of present illness. Okay, so what exactly happened on that day, you need to ask. So there were no need of asking any leading question, because complete history, antenatal history and pregnancy history I had mentioned. Okay, then medical comorbidities you need to ask, surgical comorbidities you need to ask. History in the medical thing is especially diabetes, high blood pressure, personal and family history of blood clot, smoking, alcohol. Okay, here you can also ask cocaine, because cocaine is also associated with abruption. The way you had asked me about trauma, abuse, so you can ask, and other risk factor. Okay, so other risk factor
Okay.
like we want to know why this has happened. Okay, so trauma, sex, fever, clot in person, family, smoking, cocaine. Here also you can ask, or you can ask after some time. And have you resumed after medical, surgical, allergy? You can ask, have you resumed sex? Then she will say, no, I am feeling something. Something is there. Offer then and there only psychosexual counseling, because you know
Okay.
that this is a big task. You might not be having time to address this
Mm.
problem in future. Oh yeah, it must be very okay. So don't worry, I will be offering you examination as you rightly mentioned, and if needed I will refer you to the psychosexual counseling, you and your partner.
Okay.
Contraception, COC, avoid COC, because you know by that time that her apply is positive. So contraception, she should avoid all estrogen containing or hormonal contraceptives. So you need to ask her, had someone discuss the report with you, then explain her what exactly baby's birth weight is 1.9. That has to acknowledge. You have to acknowledge that. Okay. Then abruption and positive ACA test. So these three tests are positive, rest of all other reports are normal. Protein S report is showing less is decreased, but it is normal during pregnancy. Okay, and single report will not help us to diagnose this APLA. We need to repeat it after 12 weeks. That means you have to arrange it after 6 weeks. Yes. Then you explain me regarding the APLA. Then you explain me regarding the abruption also. So abruption is basically a condition who smoked. There are multiple risk factor, and that doesn't mean that it's always your fault. Okay, sometimes
Mm.
unexplained, sometimes because of some risk factor like smoking, alcohol, trauma, high BP, or this apla, it might be the reason, huh? And yes, the chances of having abruption is 1 in 10, but 9 out of 10 times you may have a normal pregnancy. Then APLA also you mentioned very nicely that what it could be. APLA will be a sticky blood syndrome, what they are calling. That means your blood will have ability to form a clot, where blood will have a tendency to form a clot, and if
Okay.
this clot will be formed, it might get dislodged. You might have some clot forming conditions and may lead to increased risk of miscarriages, abruption. So all this could be because of that apple also. So yes, you need to acknowledge, you need to explain apple also.
Okay.
Hmm?
Yes,
Uh,
ma'am.
Meanwhile, if anytime she's having any emotional outbursts, sexual difficulties, you just tell her that all these are quite normal to feel. Huh? There is nothing wrong the way you are feeling. These are quite normal to have. This it's quite normal to have all this feeling. Nothing abnormal you have done, and yes, you are going to heal the way you had mentioned. Reassure, okay? So you are going to come out of this. Yeah, and time is the best healer. Sometimes you can take phrases just comforting, one or two words. Take your own time. Once you are
Mhm.
comfortable, you can resume sex, and it will not cause any bleeding inside. Nothing is abnormal inside. If you think you are having time, then only you can see. Okay. If you agree, I will put you in touch with the psychologist counselor. They will help you to find and cope with the situation in a better way. Okay. Once you fall pregnant, next time you will be booked under consultant lane clinic along with hematologist. Now here onward, you are going to put her in the MDT. The MDT not before only,
Before,
not
okay.
before. Okay.
Okay,
So
ma'am.
once she will be pregnant, then she will be under joint care. Hmm? It will be
Okay.
joint care, including the consultant and the hematologist. 400 microgram aspirin, folic acid, aspirin not safe, low molecular weight heparin according to the body weight. If any clotting defects can be confirmed from this month, it has to be continued throughout pregnancy up to 6 weeks. Uh, there is a chances, but meanwhile, lifestyle modalities you need to consider. Stop smoking, relaxation techniques, stop alcohol, and serial growth scan. Okay, this you missed out,
Yes,
no,
ma'am.
dear? Yeah,
And you
serial
told
growth.
last.
Yeah, serial growth scan, and depending upon the situation, may offer early delivery. If anything is concerning, we may have to offer her you early delivery, most probably by 37 weeks of gestation. Okay.
Okay,
And
ma'am.
here only, if by that time mostly you have completed your 10 minutes, so you had addressed everything. If you still have time, so I can document whatever we have discussed. Strongly suggest you to stop drinking alcohol, stop smoking, arrange appointments, redo the blood test after 6 weeks, avoid COC pill, and if your partner is feeling very low, we can discuss in detail next time in his presence. Okay.
Okay.
Yeah, so involve somewhere somehow the partner. If you see the patient safety, a certain, okay, so first is understand the impact of loss on of a depression, relationship breakdown, and takes appropriate steps. So very important to acknowledge that
Okay.
you have certain drug allergy, future pregnancy recurrence risk you have to mention. You have not mentioned recurrences. Identify high risk behavior. Almost you had identified. Offer quit smoking services. Aspirin contraindication. Heparin next pregnancy. Consultant led unit in the next pregnancy. Non-judgmental way of consultation. Avoid COC. Ensure appropriate follow-up at home by GP and social worker. Offer to see again with the partner. Clinical knowledge, discuss pathology that lead to the IUD. Okay. And when
Okay.
it is 1.9 kg, you can say that the baby's growth was not normal.
Not
uh,
adequate.
yeah, so not adequate. We don't know whether we had missed the baby's, means, less slow growth or
So that is
not.
why I asked the scans
Yes.
to address
Yeah.
that in mind.
No, so
Okay.
in there in UK, generally they do not have that serial scan. They said that okay, everything was
Okay.
normal. So it might be the reason that we might have it
Okay.
in the actually in the book it has been mentioned 2.9, but in one of the RCOG tasks it has mentioned that it was the IUGR
Okay.
baby. So acknowledging IUGR, that okay, so we will be doing a serial scan also to see. Implication of the investigation, you explain, discuss the recurrence rate, explain the risk plans, delivery and timing of the delivery, demonstrate knowledge, contemporary literature of antepartum hemorrhage, Investigation of intrauterine fetal death, repeat APLA 6 weeks. Management of APLA positive in next pregnancy. Okay. Bereavement counselor, then communication with colleague is when to involve seniors. Please unmute yourself. Okay, whenever you are joining, please unmute yourself so that it will have a lesser disturbances. Um, when to involve senior? In the beginning, you can not avoid involving senior. At the end, here you can just involve that. In the next meeting, we can see my consultant, and you can bring your partner also. So at that time, you can involve. Then bereavement counselor, SAND support group, local group, and hematologist part of the group. Review her case details so that we will be knowing the sequencing of event. Interpretation of results and investigation. Ask about general health, menstruation. Ascertain the issues about coping, feeling, plans correctly, physiology. Menstrual history is important. You need to ask rather than
Yes.
yeah. So whether it has you have started menstruating and have you resumed sexual intercourse. Current medication, drug allergy, take relevant history, identify risk factor, interpretation of report, explore her concern and fears, check her knowledge. Communication, introduce self. Course of event, confirm understanding of this. And inquiries if this has offered prior to discharge from hospital. So bereavement, debriefing and bereavement has been offered to her. You can ask.
Okay.
Mm, events after explain the course of events after loss and reassure the patient that the feelings reactions between her and Luke about Jack are normal and will get better with the time. Support from bereavement services, SANS, and clinical psychologist. Further investigation needed in the form of APLA. Proteinase tends to fall in pregnancy. Next pregnancy follow plan. Build a rapport with the patient. Ability to explain and justify the investigation. Elaborate the risk factor, and it is a non-judgmental way of consultation. So overall, a good task done by you. Time management is a bigger concern. You need to work on that.
Okay, ma'am.
Okay. Anybody is
Yes,
having
ma'am.
any question?